March 2020. As COVID-19 spread relentlessly, countries around the world implemented unprecedented measures to slow its advance. Lockdowns became the new normal. Schools, businesses and public spaces shut down, bringing life as we knew it to a standstill. Streets once bustling with activity stood eerily empty as people retreated into their homes, grappling with the new reality of social distancing. Face masks, once primarily associated with healthcare settings, became ubiquitous. Hand sanitizer dispensers sprouted up everywhere, a constant reminder of the invisible threat lurking in the air and on surfaces. Governments implemented policies to support individuals and businesses impacted by the pandemic. Stimulus checks were issued to provide financial relief, and unemployment benefits were expanded to support those who lost their jobs. The lockdown period was a time of profound disruption, but it also fostered a sense of community and resilience. Section 5. Hope arrives, vaccines and vaccination campaigns. As the pandemic raged on, scientists around the world worked tirelessly to develop a vaccine. In December 2020, the first COVID-19 vaccines were authorized for emergency use, marking a turning point in the fight against the virus. The development of COVID-19 vaccines in record time was a testament to the power of scientific collaboration and innovation. Pharmaceutical companies, research institutions and governments came together in an unprecedented global effort to develop, test and manufacture vaccines at an accelerated pace. Vaccination campaigns began in late 2020, prioritizing healthcare workers, the elderly and other vulnerable populations. As vaccine supplies increased, eligibility expanded to include the general public. Countries around the world implemented vaccination programs aiming to reach herd immunity and protect their populations from the virus. Vaccine hesitancy, fueled by misinformation and distrust, posed a significant barrier to achieving widespread vaccination coverage. Equitable distribution of vaccines also emerged as a major challenge, with wealthier countries securing a disproportionate share of early vaccine doses. Section 6. Economic and mental health impacts. The COVID-19 pandemic had a profound impact on the global economy. Lockdowns and restrictions on businesses led to widespread job losses and economic contraction. The pandemic disrupted supply chains, causing shortages and price hikes. Economists, the pandemic exacerbated existing inequalities, disproportionately impacting low-income workers, women and minority communities. The closure of schools and childcare facilities forced many parents, particularly women, to leave the workforce to care for their children. The pandemic highlighted the need for more robust social safety nets, affordable childcare options, and policies to address economic inequality. Social isolation, fear of infection, and grief over the loss of loved ones contributed to an increase in anxiety, depression, and other mental health conditions. Young student. The pandemic highlighted the importance of mental health support services and the need to address the stigma surrounding mental health. Governments and organizations implemented measures to mitigate the economic and mental health impacts of the pandemic. Section 7. Battling the waves, Delta, Omicron and beyond. Just as it seemed the world was turning a corner, new variants of the virus emerged, posing renewed challenges to pandemic control efforts. The Delta variant, first identified in India, spread rapidly, becoming the dominant strain globally. Delta was more transmissible than previous variants and caused more severe illness, leading to a surge in cases, hospitalizations and deaths. As Delta spread, countries reimposed restrictions and booster shots were rolled out to provide additional protection against the variant. The emergence of Delta highlighted the need for continued vigilance, genomic surveillance to track viral mutations, and flexible pandemic response strategies. In late 2021, the Omicron variant emerged, spreading even more rapidly than Delta. While Omicron appeared to cause less severe illness, its high transmissibility led to a surge in cases, overwhelming healthcare systems once again. The emergence of Omicron underscored the importance of global vaccine equity, as unvaccinated populations served as breeding grounds for new variants. The pandemic was far from over, and the world needed to remain prepared for new challenges. Section 8. Towards a new normal, recovery and reflection. By mid-2023, the world began to transition to a new normal. Vaccination rates increased, and the number of new COVID-19 cases and deaths declined in many parts of the world. Countries gradually lifted restrictions, and life began to resemble something closer to the pre-pandemic era. The pandemic accelerated digital transformation, with remote work, online learning and telehealth becoming more prevalent. It also led to a greater appreciation for nature and the outdoors, as people sought solace and connection in nature during lockdowns. The pandemic forced us to reevaluate our priorities, our relationship with the natural world, and our interconnectedness as a global community. The pandemic highlighted the importance of social connection and the value of human interaction. As the world emerged from the pandemic, there was a renewed focus on building more resilient and equitable societies. While the pandemic was a time of immense loss and hardship, it also revealed the capacity for human ingenuity, compassion, and resilience. Section 9. The unfolding legacy of COVID-19. The COVID-19 pandemic will undoubtedly have a lasting legacy, shaping the world for years to come. The pandemic accelerated trends that were already underway, such as digital transformation, remote work, and the rise of e-commerce. It also exposed and exacerbated existing inequalities, highlighting the need for more equitable and just societies. The pandemic underscored the importance of global cooperation and the need for strengthened multilateral institutions. It also highlighted the importance of science, research, and innovation in addressing global challenges. The pandemic served as a stark reminder of the interconnectedness of our world and the shared responsibility we have to protect one another. The pandemic also had a profound impact on the field of public health. It highlighted the importance of public health infrastructure, disease surveillance, and pandemic preparedness. The pandemic led to increased investment in public health research and the development of new vaccines, treatments, and diagnostic tools. Section 10. Lessons learned, preparedness, collaboration, and innovation. The COVID-19 pandemic taught us many valuable lessons about global health, cooperation, and the importance of preparedness. It highlighted the need for robust public health infrastructure, increased investment in scientific research, and equitable access to healthcare. The pandemic also underscored the importance of clear communication, public trust, and global solidarity in responding to health emergencies. One of the most important lessons learned from the pandemic is the need for preparedness. The pandemic exposed vulnerabilities in global health systems and highlighted the importance of investing in pandemic preparedness measures, such as disease surveillance, early warning systems, and the development of vaccines and treatments for emerging infectious diseases. The pandemic also underscored the importance of collaboration. No single country or organization could have addressed this global crisis alone. The rapid development of COVID-19 vaccines was a testament to the power of scientific collaboration and innovation. As we move forward, it is essential that we learn from this experience and work together to build a healthier, more equitable, and more resilient world.